Dr. George, can you let me know how radiation is used to treat breast cancer?
Radiation is used as an insurance policy. What it does in the setting of a lumpectomy, it helps to kill additional microscopic cells that can be around the surgical bed after the tumor is removed. These are cells that usually no imaging could detect. It's so microscopic. Radiation has come a long way. Back in the day, maybe 20 years plus, radiation used to be the whole chest wall used to be radiated, and there used to be a lot of injury to the heart muscle, and there's a lot of side effect that used to occur. Now, true to technology and innovation, radiation is streamlined and simulated specific to where that tumor was removed, and the dose is actually reduced so that the patient gets actually what it is that is needed to protect them from having cancer come back in that area. And that is what helps them with the survival rate of breast cancer and to reduce that recurrence rate. Radiation could be given on various schedules. It can be on a 3 to 4 week schedule or a 5 to 6 week schedule. Oftentimes, radiation is given in the last week. They may get in the form of a boost, which is a high dose form of radiation. And that's usually given to really um, like make sure they kill everything at that time. Um, but one of the things with radiation is the side effect of radiation could very much change among patients. I tell patients even though we know that radiation can cause skin peeling, blistering, sunburn, everybody is different. It all depends on your skin. A dermatologist would tell you, are you a Fitzpatrick 1, 2, 3, or 4? It all depends on your skin type. So, radiation, a lot of times the radiation team will educate a patient, tell them what to expect, and recommend specific creams to use while they are on treatment. And the key thing, if you develop radiation burns or skin changes, it will heal. That should not be a deterrent not to get the treatment. It will heal and you will recover. Radiation can be given while you are working. You can take it in the morning. It's like 3, 5 minutes on the beam. You take longer while you're waiting for it. And you can take it after work in the evening. It's Monday through Friday. Weekends are off and is well tolerated. So that is something that you don't have to be off from work to get. So it's an important part of the treatment.
Are there patients who have had a mastectomy who may also need radiation?
Yes, sometimes the tumor is close to the chest wall, where after surgery has removed everything, the margins are still positive for cancer. Those are the candidates that we will recommend radiation. Sometimes, even with the axillary area where lymph nodes are removed under the armpit, and large amount of lymph nodes are positive, those are patients sometimes we will recommend radiation. So those are other categories of patients that will get radiation.